Hello, my name is Laura Mosqueda, and I'm delighted that we can show you what the next phase of your training could look like. July 1st is a very exciting day. It's when I welcome our new interns, residents, and fellows.
The amount of exposure that we get as students at LA County and Keck and all these different sites is incredible.
Good morning, Mr. Reed. Oh, do you have the CT scan?
Yeah.
Let's pull up that CT scan.
So this is the CT scan from the first day.
We are smack in the middle of it all, right here in this health sciences campus. So we have a county hospital right across the street that has incredible, not only inpatient, but ambulatory facilities. Right across the street in the other direction, we have our Keck hospital with wonderful ambulatory and outpatient surgery sorts of facilities. Then on my right, we have our Norris Comprehensive Cancer Hospital. And then just across the street, we have our major research buildings too.
This one is unique because it's for cranioplasty.
Research and education are really the foundations upon which everything else at the School of Medicine is founded on. You have multitudes of opportunities to do bench work, clinical research, translational research, and really take your work from the bench side to the bedside.
Hello. Hi, Lauren. How are you doing? I'm well, thanks.
This week, in fact, we've had a sickle cell patient, an aplastic anemia patient who came for treatment. We get TTP patients. We have 3 to 5 autologous stem cell transplant patients on at any given time.
I've been here 44 years, and there's 2 common foundational principles. Number 1, patient interest supersedes self-interest. This is absolutely critical.
Your levels are coming down, looking good. So you're thinking discharge?
Yeah, I think you can go home today.
The second is that this is a teaching center, and we talk about the very famous professors that are here to teach you. But the one thing everybody learns is that the master teachers are the patients themselves.
And so, sir, we're going to show you what you actually had before and after. Okay? This is what you came in. That's what you came in with. Nearly locked out that entire lung, right? Yeah. Oh my gosh.
You must have a passion. Part of your mission is to take care of the underserved. We are serving the underserved. We are serving those that are more socioeconomically advantaged. But essentially, you want to serve everyone and everybody and serve them the same, regardless of who they are.
So who's our next patient? In here?
Yeah.
Let's go.
These are the patients that, it's not just a pleasure to serve, it's an honor to serve.
They're my people. I see myself reflected in the population.
I really wanted to come back home in more ways than one. This could be my mom. This could be my dad. This could be my uncle. And no other place could afford me that opportunity besides here.
It's been the most challenging and rewarding thing I've done in my life, being here. I've been pushed in ways that I didn't think were possible.
We're looking for that spark in a person that's going to become a good physician who's going to put the patient first.
Can we get Dr. Diggs in here, please? Can we get some backup?
No matter how dramatic this scenario is, it's something that happens.
Patient just went non-responsive, her blood pressure dropped. We are pretty much in the ORs from day one. We do cases that other places just read about in textbooks.
You really want to care for the caregiver. Our goal is to prevent burnout before it even happens.
Takes about 8 months till you start thinking, I can do this, I can master this.
Do you see anything worrisome at all? Anything new?
No, I don't.
This is not a movie, this is for real.
Can you show us 2 fingers?
It's really important that not only do they listen to what the attending has to say, but equally important, the attending needs to listen to what the resident has to say.
Show me where your pain is.
We're here to learn. There's no dumb questions ever.
We really want an inclusive environment where you can be the thought and the change leader on our campus.
It's so important to know that you're part of the Trojan family. That's not just a catchphrase here, it's something that we really mean. We care about the people who are here. We care about you after you leave. It's a lifelong commitment on our part.
Hi, this is Dr. Ponyadlu. I'm one of the faculty members of Division of Nuclear Medicine, Radiology at USC, and I'm in charge of the operation at LA County facility. The Nuclear Medicine Residency Program is a 2-year program. The Nuclear Medicine Fellowship Program is a 1-year program. And usually we recruit 1 for fellowship and 1 for nuclear medicine residency. Our translational research and animal imaging has been active. Some of the faculties, they have actually started some of the novel pharmaceutical production through animal imaging first, secured NIH funding, and they have been able to basically move it to the next level with the R01 grant from the NIH. Some of our fellows have been able to secure grants to actually start their translational research at our animal imaging first and then into the clinical trials. So we have been very successful and very blessed with our program. We also have the state-of-the-art Cyclotron facility. It's also been funded by NIH, and it's been operated by Nuclear Medicine. So that has been actively engaged in production of novel pharmaceuticals and also research products for clinical research that it's basically actively working with the department, different departments, including neurology. A lot of these pharmaceuticals that are in production now, they are at the basic science levels, but some of them, they have reached research use at the clinical levels, including movement disorders and neurology. There are numerous publications by faculties, including some of the known publications in prostates, cardiology, as well as oncology. Faculties have published many book chapters. They're very active. We have many faculties that have received international awards. They are active in presentations throughout national as well as international societies. We are actively involved with the Department of Neurology as well as Movement Disorder Division of the Department of Neurology. So there is several research that is going on, and one of them that we are ready to get engaged, which is the largest Parkinson's imaging through Michael J. Fox Foundation. So that we're actually gearing up to start that kind of that research in our campus. It's going to be a single imaging modality that is going to be used, which is a DET scan. That's basically imaging of the brain to image the receptors, that is part of the Parkinson detection. Resident fellows actually receive a comprehensive education through didactic lectures throughout the entire program. They're also engaged from early on with the therapeutic procedures, so they get a lot of hands-on experiences. The training includes lectures from the Department of Radiology as well as the division, specifically from Division of Nuclear Medicine. They are also participating at a leadership level throughout the program, so we want them to be able to run a nuclear medicine practice successfully. So we encourage them to participate in committees, including radiation safety committees, in tumor boards. They take charge within the nuclear medicine operation by working with the staff, managing the staff, participating in scheduling, protocoling. It is actively engaged throughout the entire fellowship. As part of the training, they are encouraged to participate in research activities and publications. We have had, as I indicated, some of our fellows, they have actually wrote their own grants and they started doing the research. Some of our fellows have been successfully able to secure prestigious positions in academic institutions, including Memorial Sloan Kettering, Cedars-Sinai, UCLA, and UC San Diego's, where they have continued their research activities as well as publications. Other fellows have been able to secure private practice positions in well-known and prestigious practices. There is a dedicated mentorship by faculty members throughout the training program, encouraging the fellows and residents to take charge, leading the nuclear team. That includes the staffing, scheduling, protocoling, and participation in committees, as well as tumor boards, taking charge in presenting cases, and also providing the management plan to referring physicians. This has been helpful in their interpersonal skills and also development of the decision-making process for them to be able to run a nuclear medicine program effectively. Nuclear medicine has been on a significant growth in the past 2 decades by development of new imaging modalities such as PET-CT, as well as development of novel pharmaceuticals. These added together has provided a significant growth potential with majority of publications and research nowadays in what we call theranostics. So theranostics are the growing field in nuclear medicine, and majority part of our program is to encourage the residents and fellows to take charge and also be able to, to implement all these trainings that they have within this field in the future. Now, the growth in theranostics and development of new pharmaceuticals, it's given. There are many radiopharmaceuticals that are in the pipeline that would be also coming to the market, I would say within the next 2 to 5 years. That is going to be actually adding more ways to actually treat and also diagnose the patients. We're preparing our program to be able to effectively incorporate its new modalities as well as new pharmaceuticals. And we're actually training our fellows to be able to accommodate these in the future should they join any practice or any academic institution. The strengths of our program include a caring and dedicated faculty. These faculties are well-trained, well-known, well-published, and have been awarded for their work. They basically provide education at the one-to-one level to every fellow. The campus has 3 major hospitals with over 1,100 beds, as well as 7 nuclear medicine cameras and 2 PET-CT scanners, which basically provides an ample opportunity to learn and also practice nuclear medicine effectively. The LA County Hospital, it's the main training facility, as well as Keck Hospital and Norris Hospital, offering a diverse patient population as well as a diverse disease processes. Fellows would be exposed to all 3 facilities throughout their training. They would see different disease processes at the different stages, including oncology, neurology, as well as surgery-related cases, including transplants. From day one, our fellows are participating in therapeutic as well as diagnostic procedures. These are all supervised by the faculties and staff, and using appropriate technique and also tools, we make sure that our trainees and fellows they get the best out of available tools to actually treat the patients and diagnose. Nuclear medicine has had a significant growth in the past 2 decades based on the new research and activities in theranostic. This appears to be just the beginning of even further growth in nuclear medicine. I always speak with resident fellows and encourage them to learn as much as they can and continue learning even after they graduate, because there are new modalities that are being developed, new pharmaceuticals that are being developed, and that includes better technology in PET CT as well as PET MRI. So these have been also growing significantly. We're encouraging our residents and fellows to actively participate in learning these new technologies and also adopting new technologies. The theranostic has been absolutely amazing. We're actively preparing to accommodate new pharmaceutical development that includes PSMA, both for diagnosis and also treatment of prostate cancer. This is, in addition to that, there is radiopharmaceutical for diagnosis of cardiac disease that are being developed. I'm actually heading one of these research projects myself with the expected introduction of the pharmaceutical to the market in about a year or two. These products, pharmaceuticals, have had a revolutionary effect in both diagnosing and also treatment of disease, which we're encouraging all of our resident fellows to participate in learning as well as practicing and being able to adopt these new pharmaceuticals into their practice. Radioimmunotherapy has been revolutionizing cancer management. Since it had started, although the use of radioimmunotherapy has not been well adopted, but recently it has been increasing in significance since the morbidity associated with these treatment has been significantly lower than other treatment modalities. And the result has been absolutely astonishing. So there are many that are out there now, and there are many in the pipeline that will be coming to the market.
Once you've done a residency or a fellowship here, you are ready for the next phase of your career. And that might be going into clinical practice, it might be going into academia, it might be going on for more training. Whatever it is, be assured that you are going to be the most well-prepared person possible for that next part of your career.